All right. Good evening, everybody. My name is Tracy. I'm the outreach librarian here in Cottage Grove. We're really happy to have all of you here in person and those on Zoom to our Intro to Medicare with Prairie Grove Insurance. I'm just going to take a quick moment to introduce our speakers today, and then we'll hand over the microphone. So first, Rob. Rob has been in health insurance industry since 2007 and has been dedicated to helping other people with his knowledge and problem-solving skills. Rob's devotion and focus on personal relationships sets him apart from other agents. He will walk you through every step of the process and take the confusion out of Medicare. He also brings cookies, so we love Rob. Then we have Carrie Davies. Carrie, as the owner of Prairie Grove Insurance, is involved in all aspects of the agency operations, including sales and marketing. She's dedicated to her clients and finding the best solutions available to them. Carrie will provide you with competitive quotes and exceptional customer service. So with that, we're going to hand it over to Rob.
Okay, we're ready? Okay. So again, my name is Rob Davies, and I am the owner of Prairie Grove Insurance. Just a little bit. We've been in business for, since 2007 now, for quite a few years. But we're going to go through and we're going to cover everything about Medicare today. It's just going to be a brief overview of how everything works, so you'll have a good idea of how it works. If you'd like, in your notebooks on you online, I'm going to say hi to you. But in the notebooks, is a place where you can take some notes if you want to. Pen and paper's in there as well, so you might want to take a few notes just because we're going to go over a lot of information. So do you want to? Are these? Is this supposed to? I don't think it's. Okay, so a little bit about me again. Like I said, I live right here in Cottage Grove. I'm a father and a husband or a father of two boys and a husband, um, founder of Prairie Grove Insurance. We do have a book. I did write a book called the Medicare Roadmap. Okay, and everybody got a copy of that. Anybody that's online that would like a copy of this can just let us know, and we can either get them a digital copy or we'd be more than happy to mail you out a hard copy as well. We won multiple awards in the industry, and we consider ourselves experts when it comes to Medicare. So a little bit about Prairie Grove Insurance. We're a small family-owned run business, and we try to treat everybody like family. Our approach to Medicare is we want to basically educate you so you have enough information so you can make an educated decision on how you want your Medicare to work for you. And then you can see, I don't know if there's stuff like, you can always connect with us on Facebook. There's our website. And then you can always, if you want to jot down our numbers, you can write our numbers down and always get in touch with us that way as well. So let's go ahead and jump right into Medicare. Somebody was coming in. So original Medicare, this is the foundation of Medicare. Original Medicare is going to be Medicare Part A, which is your hospital coverage, and Medicare Part B, which is your medical coverage. You're going to get what's called people get your card, your original Medicare card. Most people will call it your red, white, and blue card. But that's the foundation of Medicare. With Medicare Part A, there's no premium for the Medicare Part A as long as you or your spouse have worked 10 years or 40 quarters. There's going to be no charge for Medicare Part A, which is a hospital coverage. Medicare Part B, on the other hand, for 2025 is $185 per month. Now that can be, depending on your income, that number could be a little bit higher, or if your income is lower, that number could be a little bit lower as well. So I would say probably 90% of the people that we deal with, their premiums are going to be $185 per month for their Medicare part. Now, there's three different ways that you can enroll into Medicare. The first way is if you're already drawing Social Security before you're turning 65. The second scenario is if you're turning 65 and you're going into Medicare, but you're delaying your Social Security. And the third scenario is if you're still working, and you're turning 65 and you're going into Medicare, what do you do there? So we're going to break these down a little bit more and show you exactly how to enroll. So scenario one is the easiest way. If you're drawing Social Security, say you take it out at 62 or whenever you take it out, before you turn 65, as long as you've been drawing Social Security for 4 months prior to you turning 65, the government's going to assume that you're retired. And so they're going to automatically put you into Medicare Part A and B. You're going to receive your red, white, and blue card or your Medicare card approximately 3 months prior to the month that you turn 65. And the $185 for your Medicare Part B premium, that's going to come directly out of your Social Security check. Scenario number two, this would be as if you're not drawing Social Security, but you're turning 65. Or when would it, yeah, there you go. And you're not drawing, or if you're turning 65 and you're not going to be drawing your Social Security, then what happens is, and you want to go into Medicare, then you actually have to manually enroll. Now, there's one of four ways that you can do this. You can either do it online, which we highly recommend. It seems to be the easiest and the fastest way to do it. And we have videos and stuff that we can show you how to do that. You can call Social Security. You can go to the Social Security office. In this area, it's over on Adana Road, or you can mail in your application. So you're actually applying for Medicare through the Social Security Administration. And if you have questions on this, you can always give us a call. Since you're not drawing Social Security, they're going to bill you on a quarterly basis for your Medicare Part B. So they're going to take that $185 times 3 months, and you're going to receive a bill for roughly $555 per quarter. Once you receive your first bill, you can flip it over, and on the back side of that bill, they have what's called Easy Pay, and you can have that money directly come out of a personal checking account on a monthly basis if you'd like. The third scenario is if you're turning 65 and you're still working. What do you do in that situation? So basically, what you have the option at that point to do one of basically two things. You can enroll into Medicare just like everybody else that's might be retired or turning 65, just like we explained. Or what you can do is you can stay on your group insurance and delay your Medicare Part B. So you don't have to necessarily take out your Medicare Part B right away, so you don't have to pay that $185. Now, there's a few stipulations and things that we have to look at, but in general, you don't. And then what happens is when you decide to retire, say it's 67 or 68 or whatever it might be, then there's special paperwork that we have that you need to get filled out to prove that you've had credible coverage, and then you can take out your Medicare Part B at that time, the medical portion of this. Now, there's a few things that we want to look at when you're looking at is we want to compare the costs. So what we do is we look at what exactly it's going to cost you to stay on Medicare or go on Medicare versus your current insurance, and that'll help you determine which plan is going to be the better route for you. The other thing you want to take into consideration is you have a spouse or dependents that are on your group insurance and you still want to have them covered. So there's definitely some variables that are involved in that. So we want to look at the medications and everything. Now, when does your original Medicare begin? It begins on the first day of the month that you turn 65. So for an example, if your birthday is on June 5th, your Medicare is actually going to start on June 1st. Now, there is one exception to that rule. If your birthday is on the first of the month, let's say your birthday is on October 1st, it's going to start the month prior. So it would start on September 1st. So if you're one of those 1 in a million people that have their birthday on the 1st, like I said, your Medicare is going to start the month prior. Otherwise, if it's the 5th or 6th or 10th or whatever, it starts the month that you turn 65. So what are the major exposures in original Medicare? In original Medicare, If you said that, oh, I'm just going to take out Medicare and I'm not going to get anything else, well, this is what you're going to be looking at. The Medicare Part A deductible, which is the hospitalization, is $1,676. And that can happen multiple times throughout the year. It's for each hospital stay. And then if you're in the hospital long enough, there's going to be additional co-pays and co-insurance that you have to pay as well. With Medicare Part B, the medical portion of this, there is a deductible of $257, which is really not that big of a deal. But the big thing is the co-insurance, because Medicare Part B only covers 80%. So basically what that means is you would, if you did not have a supplement or an advantage plan or something to cover these gaps or this exposure, you would have to pay that additional 20%, which could be very, very high. And there's no limit to that at all. There's no cap. And then you also have to pay what's called the Medicare Part B excess fees, which is 15%. Now, in Wisconsin, if we set up your plans correctly, you don't have to worry about this exposure. But in other states, they do. And basically what this is if Medicare, if a hospital or facility does not accept assignment, the Medicare assignment, you have to pay 15% of the additional cost of that up until the original cost. And then, well, we can get that covered for you as well. So you want to make sure your plan is set up properly. Now, if you have special programs like the CHAMP VA, TRICARE, the VA, or Medicaid, there are special programs designed for people that have these types of plans. Now, I'm not going to get into each one of these in particular. We'd be here for 2 hours. So what we always recommend is if you do have one of these plans and you're going into Medicare, the best thing to do is just give us a call and we can look at your individual situation and tell you what's going to be the best route for you. Now, like I said, if you have original Medicare, you're going to want to cover those exposures that we just talked about. Now, there's 2 different ways that you can do this. You can either go with what's called a Medicare supplement or a Medigap policy. Those words are interchangeable. So if somebody said they had a Medicare supplement and this person over here said they had a Medicare or a Medigap policy, they have the same thing, okay? Or you can go with what's called a Medicare Advantage Plan or Medicare Part C. And we're going to break these down a little bit for you. So when you have a Medicare supplement, if you look at the left-hand side of your screen, you're going to have your original Medicare, the Medicare Part A and B that we just talked about. Then you're going to want to add a Medicare supplement or a Medigap policy to cover those exposures that we were looking at before, that 20% and so forth. And then oftentimes we need to add a standalone prescription drug plan to that. Medicare Advantage on the right-hand side of your screen, this is a combination of Medicare Part A and B, okay? Basically what's happening is a managed care type plan. So what you're doing is you're going to go to an independent insurance company XYZ, you know, there's a number of them out there, and you're going to say, okay, I want your Medicare Advantage plan. Now they have to cover what Medicare Part A and B covers, and oftentimes they'll add the drug coverage into it as well. So it's more of an all-inclusive type plan. And then we're going to break this down a little bit further. So your Medicare supplement policy, this is going to be the lowest cost when you're actually going to the hospital or going to the clinics. You have to pay for your Medicare Part B premium, the $185, plus you have to pay a premium for the Medicare supplement policy on a monthly basis. The network of doctors is phenomenal. You can go, if you have a Medicare supplement policy, you can go to any doctor anywhere in the country that accepts Medicare. So if you want to go, like I said, we're in the Madison area here, if you want to go to UW Health, or if you want to go to Dean Care, or you can definitely do that. Or if you get sick and you have to go to the Mayo Clinic, or if you travel and go to Florida, it's just like you're right here in Wisconsin. So Medicare supplements are very, very good for people that do a lot of traveling. And then, like I said, oftentimes we need to add a standalone prescription drug plan on that as well. Now, Medicare Advantage plan, this is going to be a little bit higher cost when you're actually going to the doctors or going to the hospital. You still have to pay, so it's kind of more of a, you know, as you're using the insurance, you have to kind of pay as you go. The premium for, you still have to pay your Medicare Part B premium, the $185, and then plus the Medicare Advantage premium. A lot of these plans you'll see on TV and they might be the $0 plans. Okay, so there may be no additional premiums for the Medicare Advantage plan. You do have to stay within their network of doctors. Okay, so when we're looking at these types of plans, we want to make sure that all of your doctors are in the network. And oftentimes you'll need a referral if you want to go see a specialist. And then, like I said, oftentimes these plans will include the drug coverage, the prescription drug coverage, and they have the additional benefits, like gym memberships and dental and vision and hearing and over the counters and so forth. Now, if we compare these side by side, if I just wanted to make this very simplistic for you, basically, if we had 45 seconds, I had to explain the difference between the two of them. Basically, with a Medicare supplement policy, it's a little bit more cost on a monthly basis to have the insurance. But when you go to the doctors, there's really going to be little to no cost when you're using the insurance. A Medicare Advantage plan, there's really going to be little to no cost on a monthly basis, but when you're using the doctors or going to the facilities, you're going to have out-of-pocket expenses. Just to break it down real. Now, this guide right here, this is the 2025 guide to health insurance for people with Medicare in the state of Wisconsin. This guide is from the state of Wisconsin. Everybody gets their red, white, and blue, or not their red, white, and blue, but their Medicare and U-book from the federal government. In Wisconsin, we do things a little bit different. There's basically 3 states where things are done differently. It's Wisconsin, Minnesota, and Massachusetts. So things here are a little bit different. So this guide is really the guide that you want to follow when you're looking at Medicare in the state of Wisconsin. I included one of those guides in all of your folders there. And anybody online that wants a copy of this, just let us know and we can get you a copy of this as well. Now, one thing with the Medicare Advantage plans that you have to be a little careful of, and this is just coming from the state, so I just wanted to show you this. If you look right there, it says in the bold print up top, it says Medicare Advantage plans are not required to provide these benefits. See, what happened is Medicare came in and said, this needs to be covered, this needs to be covered, and this needs to be covered. So we're going to go ahead and cover this. The state of Wisconsin said, wait a minute, you forgot about this, 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 and that. And so what are these? And right there it says Medicare Advantage plans. What are they? They're skilled nursing facilities, home health care, kidney disease, diabetic treatment, chiropractic care, hospital and ambulatory surgery center charges from anesthetics and dental care, breast reconstruction, colorectal cancer screenings, clinical cancer trials, and catastrophic prescription drugs. So your Medicare Advantage plans don't necessarily have to cover this. Now, most of the plans do cover this. Okay, don't get me wrong. But Medicare Advantage plans are sold on a medical agreement, not a contract. So at the beginning of each calendar year, they can change their plans. So if they want to not cover one of these benefits, they don't necessarily have to. And I just wanted to show you this because this is coming directly from the state of Wisconsin from their guide. It's on page 17. One exposure that nobody really talks about, and I just wanted to tell you about how this works when it comes to Medicare, is your skilled nursing facilities. Medicare will only cover you in a skilled nursing facility for up to 100 days. A lot of people think that their skilled nursing is going to be covered through Medicare only for 100 days. So basically what that means is days 1 through 100, Medicare is going to cover it, or excuse me, 1 through 20, Medicare is going to cover your skilled nursing facility 100% through your original Medicare. If you have a Medicare Advantage plan, that's the only coverage that you're going to get. So you're only covered for the first 20 days. If you have a Medicare, and so in the cost to stay, the additional cost for days 21 through 100 is $209.50 per day. So roughly about $16,000 in cost. If you have a Medicare supplement policy, it'll cover you for that full 100 days. Now, there's a few things that we need to get checked off to make sure that this is covered. So if you want to go to the next page, this guide right here, this is the Medicare and You handbook. Okay, this is the one I was telling you not to look at. Anyways, if you look down where it says skilled nursing facility, it's about 3/4 of the way down. In order for Medicare to cover you in a skilled nursing facility, you have to be admitted in the hospital for a minimum of 3 days. Okay. The other thing is you have to, when you're in this skilled nursing facility, you have to always continually show improvement. Okay. So you have to have those two boxes checked in order for it to get covered. Now, there are other plans and different things that you can do to get all of this covered. We're not going to go into all the specifics on that type of product. We're just going to cover Medicare today. But the bottom line is you just really want to know that Medicare is only going to cover you for 100 days if you have to go into a skilled nursing facility. Now, we're going to break down a little bit further the two options with Medicare. So the Medicare supplement, like I said, you still have to pay the $185 plus the cost of the supplement. It'll be the lowest cost when you're using the hospitals and clinics. You can go to any doctor anywhere in the country that accepts Medicare with absolutely no referrals, and oftentimes you have to have a standalone prescription drug plan. So these are the exposures that we wanted to cover. Like I said, the deductible for the Medicare Part A, the hospitalization, and then we also want to cover the deductibles and co-insurance and the excess fees for Medicare Part B or the medical portion. Now, this guide right here, or this sheet, this is actually in the Medicare and You handbook again. But in a lot of other states, you'll talk to somebody from another state and they'll say, I got a plan N, or I got a plan G, or a plan F, or whatever it might be. In Wisconsin, we don't have these plans. Okay, we actually we can build these plans out. Okay, now the two most popular plans right now in pretty much in the country and in Wisconsin is what's called the Plan G, which is right down in the middle there, and the Plan N. The Plan G, if you look down, it's going to be your most comprehensive policy. It's going to cover pretty much all 100% all the way down to co-payments and co-insurance and so forth. The only thing that's not covered would be the Medicare Part B deductible, or that $257. Now, Medicare, or the Plan N, if you look at that on the far right-hand side, it still has those 100% all the way down. The two things that are left open here is the Medicare Part B, that deductible of $257. And in the state of Wisconsin, like I said, we're a little bit different. We can put 100% where it says Part B excess charges. We can actually get that covered for you. So it makes it kind of an attractive type plan. So let me show you what we have to do to build these out. So what we do is we actually have a base plan in Wisconsin, and then there's a number of different riders that we can add to it. You've got your Medicare Part, or the Part A deductible rider. You can do what's called a 50% Medicare Part deductible rider, which we don't necessarily recommend. Why only cover half of your hospital stay when you can have the whole thing covered? That's one thing I'm going to kind of touch on a little bit. People from other states, or if you talk to agents that are not from around here, they don't necessarily know how to build these plans out correctly. And they'll come in with a lower premium. Well, the reason why is they're either leaving a rider out, or they're putting 50% coverage and so forth. So it's important to make sure you talk to somebody that knows what they're doing with these riders. And then we can add the Part B foreign travel rider. So if you say, if you plan on leaving the country, we can get you covered for leaving the country. The home health care rider, the Part B deductible rider. Now, there is an asterisk to that. We can still get this covered for you, the Medicare Part B deductible rider at $257. If you were first eligible for Medicare before January 1st of 2020. So we used to be able to get plans where you would literally have no medical bills. Okay. Well, the government does not like those types of plans. They said that people that have those plans are abusing Medicare. This is what the government says. So they said anybody that Because if you went to the doctor, you don't have any bills. So for every little itch or scratch or bump or bruise, people are just running to the doctor or to the government. So they said anybody that's eligible for Medicare after January 1st of 2020 has to pay that Medicare Part B deductible first, and then you can have 100% coverage. And then we would add the Medicare Part B excess rider. And then if we want to go to the copay plan, you'd have the Medicare or the Part B coinsurance rider as well. So we have to select different riders to build these plans out. And we're going to show you how we're going to do a couple examples here right now. So the Medicare, the Plan G, okay, like I said, it was the most comprehensive plan that we can get if you're turning or eligible for Medicare after January 1st of 2020. The average cost of one of these plans here in the state of Wisconsin, it's going to be depending on your zip code, is anywhere between $100 to $150 per month. The only thing that you have to pay for would be that $257 deductible. How we build this plan out is we'd actually have the base plan, and then we have to add the Part A deductible rider, the Part B foreign travel rider, the home health care, and then the Part B excess rider. And then they would have what's considered as a Plan G in other states. The Plan N typically is about $20 to $30 less per month than the Plan G. What you have to pay for is you'd have your $257 deductible, the Part B deductible, which is based off of calendar year. So that's from January 1st to December 31st. And then every year the government can change that. Last year it was in 2024, that deductible was $240. This year's $257. So you'd have that deductible. Once the deductible is met, you'd have a $20 copay for office visits and a $50 copay for emergency rooms. Now, if you're admitted in the hospital, they waive that $50. And a lot of people like this plan. People say, I don't really go to the doctor very often, but I still want to have, you know, a really good Medicare supplement coverage. A lot of people will go this route. Now, how we build that plan out is we actually we have the base plan, and then the riders that we add to that is the Part A deductible rider, the Part B foreign travel rider, the home health care, the Part B excess rider, so we can get that 100% covered for the excess fees, and then we have to add the Part B coinsurance rider as well. Now, if you told me, Rob, I'm never going to leave this country ever again, we don't necessarily have to put the Medicare part or the foreign travel rider on there, but most companies charge anywhere between 30 cents to maybe $1 per month. So it's very, very minimal to add that rider. Now, when is the best time to enroll into a Medicare supplement policy? 3 months prior to your birthday. Okay, other states you can do it 6 months. Here we can do it 3 months prior to, well, I shouldn't say your birth month, but when your Medicare actually starts. So we have 3 months prior. You want to try to get it done right away. The reason why is because we can lock your rates in at that point. So you're going to get the least expensive rates. The other thing is if there is any mistakes, they don't mail out the cards or something like that, we can get all your cards and make sure that everything's in place. So when you are starting your Medicare, you have everything in place. And then the nicest part, or what people like to do, is they want to get it checked off their list. Nobody necessarily really likes to, except for me, talk about Medicare all the time or have to deal with it. So now all of the plans, they are federally regulated, so they're federally standardized. So whether you have a company, ABC or a company XYZ, all of the plans are federally regulated, so they're going to be standardized. So they're all the same. Okay, because your Medicare is your primary insurance. As long as the riders are on there, all of that is the same. Now, with the Medicare supplement policy, you do have to add a standalone prescription drug plan. I shouldn't say you have to, we recommend it. Because some people will tell me, Rob, you know what, I'm on no medications right now. So why should I even take out a drug plan at all or take out a standalone prescription drug plan? Well, if you don't take out a prescription drug plan when you take out your Medicare Part B, that is, you get penalized 1% per month, that every month that you could have had insurance that you didn't have it. So for an example, say you said, I'm not going to do anything, and all of a sudden 5 years go by, and that's 60 months. Well, now basically what happens is you have a 60% penalty when you go to take out that plan at that point for the rest of your life. And that's a 60% penalty on the average cost of a Medicare Part D or Medicare standalone prescription drug plan in the country. Right now, the average is roughly about $32 per month. So you'd have roughly a $16, $17 penalty for the rest of your life. So we always encourage you to take out some type of a plan. In Wisconsin, we have a plan called Senior Care. And some people that are on no medication will use that as a placeholder. It's $30 per year. They can get on that plan and they can, um, just to really avoid that penalty. Now, the best time to enroll into a prescription drug plan is typically 60 to 90 days before your Medicare actually starts. Now, how we do this, if you say, Rob, well, that's great, but I'm actually on a lot of medications. Well, what we do is we have an online calculator where we're going to put in, put your pharmacy in there. We put your zip code in there. We put all your medications in there, and it's going to list every single plan that's available in the area. Right now, there's about 20 different plans available, and it'll list it from the least expensive to the most expensive. So obviously, we just want to put you in the least expensive plan. Every single year, though, you want to review these plans, okay? And we can do that for you. And basically, that's between October 15th and December 7th. This is when you see all the TV commercials. This is called the annual election period. And every year during that period, we want to look at your drug plan, or you can do it yourself if you'd like, um, and figure out what's going to be the best plan for you, because Medicare Part D plans change on a yearly basis. They'll change the premiums, they'll change the formularies. You might go on different medications or go off a few medications. So it's always good to review these plans on a yearly basis. So just to kind of give you a rough idea of what it would cost if you went the route of a Medicare supplement, you would have $185 for your Medicare Part B. You would have your Medicare supplement to cover what Medicare Part A and B doesn't cover, for roughly anywhere between $100 to $150 per month, depending on your zip code. And then if you're only on a few generic medications, it's going to be roughly about $15 a month. If you're on a lot of medications, we'll run that for you, and that way you can get an exact cost of what that might be. Now, option number 2, the Medicare Advantage plans. You're going to have to pay the $185 for your Medicare Part B plus the cost of the Medicare Advantage plan, which a lot of times are zero. You're going to have a little bit higher cost when you're actually going to the hospital or the facility, so the doctor's office. And then we want to make sure that your doctors are in the network and typically need a referral. And most of the time, the drug plans are just included in these types of plans. Now, how these plans work, like I said before, these are a managed care plan. So what you're going to do is you're going to pick a company, whether it's, Humana, Aetna, whatever company it might be, and you're going to say, okay, I want your Medicare Advantage plan. What the government does is they pay the insurance company a certain dollar amount per month, okay? And now you're going to be covered through that particular insurance company. And then oftentimes, like I said, they'll include the drug coverage. Now, a lot of times these plans, the premiums on these plans can be $0. So it's but you still have to pay your $185. But like I said, with these types of plans, every time you use the doctor or go to the hospital or clinics, you are going to have co-pays and deductibles and co-insurance, and you will have max out-of-pockets as well. A lot of the plans in the state of Wisconsin are going to be anywhere between $3,000 to roughly $8,000 per year. So if you do get into some medical issues, you could have some pretty hefty out-of-pocket expenses. And then oftentimes there's additional plans that we can add to the Medicare Advantage plans to make them a little bit more beneficial for you. And we're not going to get into all of those today. So now, how do we figure out what's going to be the best plan for you with a Medicare Advantage plan? The way this works is we have to look at your zip code, and then we want to make sure that all of your doctors and in the hospitals are in network, and then we want to list your medications. And then we also want to look at if you're interested in additional benefits like gym memberships or dental, vision, over-the-counter benefits, and so forth. We put all this information into a program and it lists all the different plans available in your area. And then we figure out what's going to be the best plan for you in that area. And then every year we want to relook at these plans during that annual enrollment period between October 15th and December 7th, because these plans can change on a yearly basis as well. So we want to make sure. Now we've got people on Medicare supplements and Medicare Advantage plans. Our job is not to sway you one way or the other. Our job is to educate you so you can figure out what's going to be the best option for you. Now, when is the best time to enroll into a Medicare Advantage plan? It's going to be 3 months before you're turning 65 or before you're starting your Medicare. Now, oh, I just kind of mentioned this before, but every year what we want to do is we want to review that plan for you, just because things change, and the plans will change. You might be in a Medicare Advantage plan, and then next year you find out, if you don't review it, find out, well, maybe your doctors aren't in network any longer, or maybe they're not covering some of your medications. So it's very important to review these on a yearly basis, just so you make sure you're still on the best plan for the best price. Now, just comparing the two options just side by side again, like I said, we've kind of beat this to death, but Medicare Advantage supplements are going to be the lowest cost when you're actually using the facilities. Medicare Advantage plans are going to be a higher cost when you're actually using the facilities, but it's going to be a lower premium. Now, a lot of people say, well, why don't I just go right to an insurance company and purchase a product through that? We always encourage people to use a broker. Okay. The reason why is we don't charge any fees. We get paid directly from the insurance companies. We don't get paid from you. So it costs nothing to use a broker like ourselves. If you go to an insurance company, you purchased a product, or you purchased it through a broker like ourselves, it's going to be the same price. So it's the same cost either way. And then what we do is we have a number of different companies in the area that we represent. So our job is to look at the different carriers for you and find you the best plan for the best price. We're not biased towards one carrier or another. The other thing I should mention before we went to that is the other nice part about using a broker is then you have somebody that will actually review your plans on an annual basis. Now, we actually do provide lifetime billing and claim services, so if you do have questions with bills or anything like that, you can always call us and we take care of all of that for you. So I wanted to thank you for attending. Do you guys have any questions at this point? I know we covered a lot. Well, it all depends on the broker. Okay, we at Prairie Grove Insurance, we send out letters and notifications every single year to people. We kind of keep people on, with emails and stuff like that. But every year we send out notifications to everybody that, hey, it's this time of year, we want to review this. Unfortunately, not all brokers are the same, so some don't necessarily do as good of a job as we think we do. So, but yeah, no, we definitely contact everybody. Yep.
I have advantage here in my life that I union
Mm-hmm.
and I really don't like it.
Yep.
So if we would want it, I don't know whether they cover that, and you just go in and get what's missing online to another insurance company, not just get the one excess.
No,
You
yeah, the Medicare Advantage plans, we can't add the foreign travel or anything like that to it. What we can do though with a Medicare Advantage plan is they do have policies out there like hospital indemnity type plans, um, additional coverage that you could add to the Medicare Advantage plans to make them more attractive, or so you don't have as much exposure as you would before. Like a lot of Medicare Advantage plans for the first 5 or 7 days or whatever, if you're in the hospital, you might have a $250 or a $300 copay. Well, we can actually show you how you can get that covered. The other thing we can do is we can show you on days for the skilled nursing facility, Dave, remember when we talked about days 21 through 100, where you'd have to pay that $209.50 per month, roughly $16,000. We can show you how to get that covered as well.
Okay. So insurance companies are kind of using, that's kind of the mechanism that they use to cover. Like ours is through, what's the hospital? Not for, that's it. Mercy. No, it's for the hospital.
Is it what? I don't know. That's the big ones around here.
Yeah, I just get the hospital. Did you say GHC? It's not GHC, it's a hospital, I could just get. But, what's that? No.
It wouldn't be Gunderson Lutheran. That's too far away.
No, I don't know, but,
Well, you know what we can do for you if you want? We can always take a look at your policy, just lay it out and say, hey, this is where the gaps or where the holes in the coverage are. And we can show you how to plug those holes.
okay. Because you're self-insured,
Mm-hmm.
so we just use, I can't remember. No. Yeah, I have a card. It's terrible. I don't use this, but, somebody else had a question, but I think they. Oh, yeah, up here. Yeah, Blue Cross Blue Shield.
Okay, so you got a Medicare Advantage plan through Blue Cross Blue Shields. And so, like I said, what we could do is the unions, even though what we would do is we would just look at your outline of coverage, and then we can see where, there's gaps in the coverage. And we can plug those holes with additional type of plans if you're interested in that. And a lot of people do that.
Yeah, we do, yeah. So that's,
Just, how long do you go? Week, 2 weeks, a month?
give me like 5 weeks. So-
5 weeks. So you can generally pick up, plans for the, when they call Geo Blue is one of them, and there's the other one. So you get those. And they're really inexpensive, though usually they'll have like maybe a larger deductible, like 5 or 10,000, but it goes up to $1 million, if something's bad.
And some of the Medicare Advantage plans actually do,
20,000 normally.
it does have some foreign travel coverage in there, so. We would just want to look at your policy or the outline of coverage, and then we can just say, oh, this is what you've got.
Yeah.
You got 20, and then you can kind of fill in the gaps at that point.
I'll get a hold of them. See what they can give me. Okay.
Yeah, sometimes you can get it online and things like that too, so.
All right, thank you.
And then one thing, if you do, something does happen to you outside of the United States, the company is going to want every detail on that. You have to do that. No, you don't need it. Medicare Advantage, generally they want that though, and we've had a word like we need it in at least gonna give me a question. You're gonna have to figure this. So, but they're gonna want even. You wanna know the hospital, they'll wanna know the hotel that you stayed at to prove you were there, and they wanna know that you're in the place. So they want a lot of information, so you want to tell them that. You say having, coverage, is that story for management? Travelers and Geo Blue would be just for medical, yeah. And those are just medical policies, but they're generally inexpensive, so, because even people on supplements, like a 50,000, they're like, you don't know, I mean, anything can happen. Cruise ships are the worst, so you don't know about it.
What about cruise?
Yeah, that can be a challenge. And we do get foreign travel claims, not all the time, but
No, but
I
when
think
they
you
come
get-
back,
we do get them.
Out of pocket then, and then Medicare.
Yep, it's a reimbursement. Yep, so basically you get reimbursed for those types of coverage. Yeah, because they don't have contracts with Jamaica, you know, or wherever you go, you know. So. Any other questions? Is there anything online?
there's no questions on Zoom, that's what it's now. Okay. Did you guys still have questions on your code process? Yeah. Or on how it works, or? Yeah, but it's so new to us and it's so different than other people. Other insurance, it didn't matter. You know, when you go to the doctor or anything like that, you didn't pay anything. When you had an ambulance, didn't pay anything. My husband, when he died from January to June, I'll make a bet with you, I have called the EMTs out there probably about 7 or 8 times. Probably 5 times to take to the hospital and 3 times we have to get them off the phone. And I never had to pay anything. So that's what you were that with the post office insurance, you're gonna have to. No, I think now that they made this change over to this other insurance you're going to have with. That's what I mean, now that you had. Right.
Well, you know, it's completely up to you, but you could always give us a call. And we would be more than happy to sit down and take a look at what your policy, what you have. And just show you, just lay it out and say, this is what where the holes are. Or we could say, you know what, you have great insurance, stay exactly where you're at, you know?
You don't know because.
We haven't used it.
Just before.
Yeah. Well, you know what? I always tell people that, you know, insurance is the only product you purchase that you hope you never have to use. You know, and you never know how good it is until you use it.
If you got an explanation of benefits, we could read through it and it would be.
Yeah, we read through these all the time.
Are you guys seeing the one over in Pittsburgh? No.
No,
Okay. Okay, one another one? There's one over in Pittsburgh. We didn't know all of this. Oh, no, that's, yeah, no. It's part of the paperwork we can look at it, you know, there's so many different scenarios. You said you have it, or one of you said you have it? Yeah. And both of them have it. It'd be interesting to see. I know we've taken a lot of people off the post office, but I think it was because of the price more than anything. You guys are eligible for a full comprehensive plan because nobody for 65, so those are expensive.
mhm. The one gentleman, I think he showed me, I had the email, he showed me what the post office had and what we could get him, and it was significant. I would say it was probably a couple $100 less a month per person, you know, with just good or better coverage. But that was his particular situation. Like I said, it's different for, you have to take in gender and age and zip codes, and there's a whole bunch of things that come into play. So,
Well, if we would move, we talked about moving, that for the firm. We would want to go off of Medicare Advantage then, like,
well, where would you move to?
it would be like California. But
Okay, so basically what happens is if you move out of the area and that plan is not offered in that area, typically what'll happen is you have a 63-day window that'll open up. Now, every state's a little bit different, where you can get a different Medicare plan with absolutely no underwriting. What I mean by underwriting is they're not gonna ask you any medical questions. Because if they don't service that area, you can't have that plan any longer.
yeah, okay. I know what you meant, but that's the one.
Mhm.
Medicare Advantage.
Yeah, that's
So the name is that where you're going?
We go, we used to have 40 pennies.
Okay, that's important.
Okay, so. Okay.
Mhm. But I think what we should do is, like I said, we could take a look, because, to kind of take a look at your policy and just kind of see what you actually have and show you, hey, if you get cancer, this is what you could be up. Because a lot of Medicare Advantage plans right now, if you get cancer, you have to pay 20% of that bill until you hit your max out of pocket. Yeah. And so there's ways that we can cover those holes. The other big one is, like I said, is if you went to a skilled nursing facility to get that $16,000 cut. And these policies are pretty inexpensive. They're not like hundreds and hundreds of dollars, you know.
These are like our advantage is it's 165 for both of us. Okay, that's pretty good. Yeah.
It depends on budget.
What the coverage is.
Yeah.
But you guys get a lot of extra benefits to do that.
Yeah, I just checked into it, because I know I'm adding picture.
Oh.
I'm retired for like 10 years, but I just been on her, or B,
How long ago did you go on this insurance?
I'm sorry.
How long ago did you go on the Humana plan?
I had, he's retired, had to retire this year. So I have to, do all the paperwork,
Oh,
whatever.
we should look at, we should look at that before you get too far into it, just to see, just compare what's out on the open market compared to what they're offering,
Yeah,
and just lay them out side by side. And if your union insurance or that insurance is better, then by all means, we want you to go that way. But if there's something better, then,
yeah.
it doesn't hurt just to check.
No, that's why we're here.
Yeah. So,
Okay, cool.
are we still recording? Oh, geez.
I cut the Q and A out of it.
Okay.
Yeah. Scott online says I'm good. Thank you so much for the information. Thanks for attending, Scott.
Thank you. Anybody else any questions? Well, it wasn't quite an hour, so.
Thank you.